Hello, I'm Dr. Patrick Hwu, CEO of Moffitt Cancer Center, and we're here in Houston, Texas at the 2024 annual meeting of SITC. I'm here with Dr. James Gulley, the SITC president-elect and also clinical director of the NCI. So thanks so much for being with us here today, James.
My pleasure, Patrick. It's really great to be here in Houston.
Okay. Well, you've been in the immunotherapy field for a long time. So tell us, what are you most excited about here?
Well, so there's several really interesting things coming up today at SITC. One thing that I really am very interested in is a new agent called STAR 0602 or Invicafusp alpha. This is an agent that is a bispecific that grabs onto the TCR receptor via the V beta 6 and also brings on the other arm of the antibody IL-2. They can bind in cis to the same T cell, causing two signals to go for the T cells. Those T cells then can become very activated in a way that's unique to this dual activation that leads to a T cell that is very good at killing.
So you're activating through the T cell receptor and you're giving a growth factor, interleukin-2.
Yes.
Yeah. But I guess what's the specificity of that if it's just hitting one class of the T cell receptor?
Yeah.
Is it going to hit the ones that recognize the cancer?
Yeah, so that's a really good question. What we found is that in the TILs, the tumor infiltrating lymphocytes, there are many different V betas. But among the most highly expressed are these V beta 6 and V beta 10 that this binds to. So about 12% of the TILs are in there. So in this first in human study that we've looked at, what we're seeing is we're taking patients that have high tumor mutation burdens or viral associated cancers and trying to see, do we get a subset of those cells that we activate that can lead to good activity in the patients. In fact, that's data that's going to be presented on Saturday, and there is some interesting clinical data in there. In addition, we're seeing specific activation of just those V beta 6 and V beta 10 T cells.
What about the toxicities? Are you also activating cells that will cause colitis?
Yeah, so great question. So what we're seeing is that we're seeing, like other T cell receptor agonists, we're seeing some cytokine release syndrome, but not a lot because it's only activating a subset of the cells. In addition, we're not seeing any autoimmunity or other types of immune-related adverse events that we typically see with immune checkpoint inhibitors, for instance.
So in a couple of months, you're going to take over as president of SITC. Let us know what you're really going to try to focus on in your 2 years as president.
Yeah, so there's lots of really cool things that I want to do as president. So one of the things that has really been interesting to me in the last couple of years has been the explosive opportunities with artificial intelligence. I think there's a lot of opportunities here to improve our efficiencies in clinical trials using large language models, really to help there with things like the informed consent, making that simpler and shorter, and maybe even helping with translation, but also taking things like, can we take things from the electronic healthcare record and push it to this electronic case report form where we're getting all of our research data from? I think there's lots of opportunities there. Some of those are immune specific, like immune-related adverse events, taking that from the electronic healthcare record. I think there's other areas, though, that are really going to be important as we move forward, really understanding the biology of the impact of the immunotherapy in the tumor microenvironment.
Well, that's great. Those are great topics, and it's really interesting because SITC ran the crisis in clinical trials in the last couple of years, talking about how we really don't have enough resources and people to run all these trials with all these exciting agents. And one of the issues is the cumbersome nature of clinical trials. And as a trialist yourself, you're saying the use of generative AI may really simplify some things.
Very much so. So if you could take the data directly from the electronic healthcare record and push it to the research record, as you will, right now, we're requiring people to do manual data entry in something that's already in a computer system. That's kind of crazy, right? If you could just have an IT solution, that would be much better. You could not have to do this manual data entry, and you wouldn't have to have somebody to monitor that you're getting exactly the right stuff. It would just be done automatically. This could take out layers of people and much time and save a lot of money for clinical trials.
Well, it's exciting because there's so many great agents out there that we really have to get the trials run, right?
Absolutely.
Yeah. Great. So here at the annual meeting in Houston, tell us what are you most excited about with this annual meeting?
You know, I think with this annual meeting, the thing that actually is the most exciting to me is being able to meet so many of my friends and so many of the people here. We have so many different meetings lined up. The science is going to be incredible too, and I think that some of the science that is going to come out here is actually going to change how we do research, and that you know, those two components, the people and the science, that's what keeps me coming back to SITC every year.
Wonderful, and I know another role of SITC is really to bring up the next generation of investigator. I know you yourself are a great mentor. I know you've mentored many people, many successful people in the field. So what are some of the things that SITC is doing to try to bring up that next generation?
Yeah, so I think the next generation, so first of all, I would say that the next generation is the future. And what we are doing in SITC, we have these speed mentoring events. We have, today we had the Meet the Experts roundtables, where people that are leaders in the field can sit down with the next generation and really just have this one-on-one or one-on-several conversations that can really give them the impetus to go forward, help network, help them find people, find places that they want to go next.
Well, thank you, James, and I'm really excited. I know you're going to do lots for SITC as president in the next couple of months, and so thanks for being here with us today.
Absolutely. Thank you, Patrick.